In this module, I'm going to speak about the duration of pharmacologic prophylaxis once we've decided at the time of admission to prophylax a patient with low molecular weight heparin or unfractionated heparin against DVT. Generally speaking, we're going to continue prescribing prophylaxis for about 10 days, sometimes up to 14 days. And it's easy to lose sight of this fact, particularly if a patient is transferred from one service to another. There can be the ball getting dropped. Sometimes now with reduced house staff hours, the 80-hour work week maximum, a patient might be transferred to a service or new orders have to be written, and the night float could simply not have been informed to continue prophylaxis orders. And sometimes the night float knows that prophylaxis orders should be continued, but assumes that the day person is taking care of the job and doesn't necessarily check on the orders to make sure it happens. Or a patient could be receiving enoxaparin prophylaxis, for example, in the emergency department, and there's not a bed upstairs in the hospital, and the patient is admitted, but then the entire medical team assumes that naturally when the patient finally gets a bed upstairs, that prophylaxis orders are going to be continued when in fact they're dropped just as an administrative glitch. So I think it's important that we not assume that once we write an order for prophylaxis at the time of admission to the hospital, that the prophylaxis will follow our intention and continue for 7 to 14 days. That's usually our intention, but we have to be forever vigilant that our intention is carried out. Now, in subsequent DVT wraps, I'm going to talk about changes in patient risk during the hospitalization, and then in further DVT wraps, I'm going to talk about hospital discharge planning and specifically about continuing prophylaxis after the hospitalization is completed. But for now, I just want to point out what we all know, that a hospital is a very hectic, complicated place administratively, and that we cannot make any assumptions. We have to be forever on the lookout to make sure once we've ordered prophylaxis that it continues straight through to the point where we might want to specifically discontinue it. Now, when I say 7 to 14 days, that's not just picked out of the blue. That's based upon the evidence from randomized clinical trials, which you can download from this DVT wrap website.